Beneath the colorful tapestry of everyday life in Nigeria, a silent epidemic is taking hold. Diabetes. This disease, often overshadowed by more visible health crises, is quietly ravaging lives and fracturing families. Nigeria is home to over 200 million people, 11 million of which have diabetes, some without them even knowing. Once considered a disease of affluence, diabetes now affects millions of Nigerians across all socio-economic classes. 1 out of every 17 adults in Nigeria is living with the disease.
I was diagnosed in 2019. That year, I had a long and very productive year at work, but so I figured that it was stress. I was tired, and I had started to put on weight. I noticed that my feet were, fat. I had two strokes, and I was pretty much exhausted the entire time. First time, I think I was working late. This is 10 p.m. at work. I was working, and then I noticed that I couldn't feel my right side. I didn't know what was happening, so I managed to slid under the table and just stayed there um, until it passed. Scary now that I think about it. And so we went to the hospital. We thought it was malaria or something. Doctor was running a lot of he took a look at me and said, what, let's run these tests. So while we were speaking, I excused myself to go and pee. Came back, went to pee, came back, went to pee, came back, and he admitted me. Came back again. He wanted to be sure. Came back again, and he was talking to my mom while I was in the room. In the space of 5 minutes, I had gone to pee 10 times. And I'm not even exaggerating. And that was where he just asked them to run a blood sugar test. I ended up spending 3 months in the hospital.
The rise in diabetes in Nigeria is closely tied to shifts in lifestyle and diet. While traditional Nigerian foods are rich in culture, many are high in carbohydrates and sugars. This, combined with an increasing reliance on processed foods and sugary drinks, is fueling a health crisis. As our diets evolve, so too do the risks, putting countless lives in jeopardy.
It is now almost an epidemic in Nigeria, and it is a major risk factor for what I do, cardiology, heart attacks, strokes. Majority of the patients who come in with heart attacks and strokes have diabetes. And the reason why the incidence of diabetes has gone up so much is we have developed the bad habits of the West. So a lot of people are overweight. Most of the diabetes in Nigeria is type 2, which is has a direct relationship with weight. So the bigger you are, the higher your chances of developing diabetes. The more sedentary you are, the higher the prevalence. If you have a family history, the higher the chances you get diabetes. So it's quite common now. Very, very common. We are eating badly, we're not exercising, we are overweight, and our eating habits are not the best. When I say food, becoming overweight, whatever type of food you eat puts you at risk. So, and then not exercising also puts you at risk. So if you're prone to it, and then you now gain weight, you don't exercise, you eat all these high carbohydrate foods that predispose you, then you put yourself at risk. Now, the key is not sugar that is the cause of diabetes. A lot of people think, oh, I don't eat sugar, so I can't get diabetes. No, it is not sugar. For people who are prone to diabetes or who have diabetes, what makes their sugar go up is carbohydrates. And it's the refined carbohydrates that get converted to sugar very quickly in the blood. So the bad things, bread, rice, dodo, fried plantain, the ripe one, those are very, very bad for those of us with diabetes. Oh, sugary drinks, yes. Now, one lump of sugar, one cube of sugar in your tea is not going to cause trouble. But when you drink a bottle of Coke, that's 14. Or Sprite, Fanta. Maybe I'm not supposed to name the brands, but any soda, it's about 14 cubes of sugar in there. That's a lot.
14 cubes.
14 cubes, yeah, in a bottle of soft drink. The treatment options, there are many, but some of them are very expensive. The most notorious one you've all probably heard of, Ozempic, that's used for weight loss. Its first reason for being approved was diabetes, and they found that you could lose weight. It's now costing about 500,000 naira a month. Not many people can afford that for Ozempic. So yes, many of the drugs, after the first line drugs, second line drugs, the rest are very expensive. Very expensive. Most people's salaries cannot cover the cost. So it becomes a real problem.
For those diagnosed with diabetes, managing the disease is a lifelong commitment. A journey filled with daily medication, constant blood sugar monitoring, and regular doctor visits. Yet, in Nigeria, this essential care comes with a staggering price tag that many cannot afford. The average cost of medication at 150,000 naira per month is more than double the national minimum wage.
Of course, as with every other commodity in Nigeria, the prices of medications have also gone up. The price of medication 6 months ago is not what it is today. So the inflation has also caught up with the health sector. A year ago, Foxiga used to be about 30-something thousand, but today Foxiga is 65,200. Galvosmet is another popular one. Galvosmet sold for less than 30,000. Today is about 40,000 naira. So I think we had the highest jump in insulins because Novomix used to be a full pack of 5 pence should cost about 40,000-50,000. But at some point this year, it sold for 102,000. But these days, we sell Novomix for about 85,000 naira for a pack. A very good example is Lantus here. Lantus is made by Sanofi, and Sanofi used to be here in Nigeria, although they used to import directly. But these days, Sanofi is no longer here, and Lantus experienced about 100% increase in the price for a full pack. Okay, sometimes the increased prices comes as a shock to some patients, and some of them intended to buy maybe 3 months worth, and they end up leaving with just 1 month pack, 1 month supply. Sometimes some patients will tell you that they're going to have to come back. In the case of injectables like this, most times patients always want to go with a pack. Maybe a pack will last them for a month or 2.
Nigeria's public health infrastructure is struggling, and so quality healthcare remains a privilege of the few, typically found in only private hospitals, leaving the majority of Nigerians without the vital care they desperately need. This inequity not only endangers individual lives, but also threatens the well-being of entire communities. Families across Nigeria are being forced to make heart-wrenching choices between basic necessities and life-changing medication.
Kubaya mshepa na ikusan machimfo dagambala asibiti mala ala mumangu mchiwa shuga helele
makaya mbeche mkuku makaya adremenu aje mukundu akwa na ya ngifi duka mo kunbala basa ige miye ga mtami mafale nu mengelo shekote ma wo bayi mu
isa meshi ma jidamu ma dar ma chiwi nga mafu fi hasan fi anga mu yemeje fi ko fi
za helele ma sister wango shembe chiga male me baga yeshi bala mzo yeshi gote mele mete gele imagine na wango yemba fa ko mi bala ga shoko ba kwa chokwa o
ba chi buga gwamnati abmameji abadmameji imagine ba ko ga ba abmameji ba ji ma bo war kaso abaga ma shigbon na ba jimu yangi nu gana damwa de dem ko le ko yangi zoko ko na shigba zoko Ndamwa elele.
We had a patient coming 2 nights ago with two of the worst complications. There's something called diabetic ketoacidosis, where your sugar goes up really high. There's a lot of acid ketones in your body. It puts you into shock, and then you also had a heart attack at the same time, massive heart attack. So you had both of them, and somehow came through still with us. But yes, those are some of the complications. But the common complications you need to it damages your eyes, it damages your kidneys, gives you kidney failure. It affects your heart, gives you heart attacks, heart failure. It affects your brain, strokes. It affects every system in the body. Most people you see with one leg or two legs amputated is a complication of diabetes. So untreated diabetes is a mean disease. It will ravage your body. I don't think it is just the job of the government. It's all of us. The medical societies, churches, mosques, civil organizations, social media. These what do they call these guys now? Is it content people? I don't know. There's something you guys do on social media that have a lot of followers. Those guys should all help in educating, but people don't like to listen to things like that. It doesn't bring in viewers and all that stuff. So, but it's important all of us take part in educating as many people as we can, not just leave it to the government.
Public outcry is growing as more Nigerians struggle with the burden of diabetes. Civil service groups and healthcare advocates are calling on the government to take immediate action to subsidize essential medications, improve healthcare facilities, and invest in public health campaigns to educate the population about diabetes prevention and management.
The role of the government is to create policies that ensures that public health in Nigeria is in a good place. I know that the Ministry of Health developed a national plan for the control of non-communicable diseases, which of course diabetes is a non-communicable disease. So we have all of these great policies that exist. However, implementation has been far from what's expected with regards to, just preventive education, screenings to ensure that people are aware of their sugar levels and people are aware of the risk factors of some foods such as sugary drinks and how that can contribute to the rise in diabetes in Nigeria. So with regards to policies, we do have some policies that have been developed to curb the rise of diabetes or just, prevent it from even happening in the first place. However, when it comes to implementation of these policies and it being implemented effectively, that has been lacking on the government side. Gatefield has been advocating for sugary drinks for a couple of years now. Our advocacy led to the introduction of Nigeria's sugary drinks tax. And I think the rationale is essentially the health risks that I've mentioned earlier on that are associated with consuming sugary drinks. So sugary drinks or minerals or carbonated drinks, as we call them here in Nigeria, are loaded with tons of sugar that offer no nutritional value whatsoever. And when these drinks are consumed, it essentially goes straight into your bloodstreams. And there is low level of awareness when it relates to how really harmful these drinks are, especially when it's being consumed on a regular basis. And sugary drinks are quite affordable here in Nigeria, as well as in other low and middle income countries, which is a target by the industry because we are targeted because, we're seen as poor and we can afford all of these drinks. But on the flip side, high consumption of sugary drinks. Nigeria was once the fourth highest consumers of sugary drinks, and high consumption of these drinks also leads to high onset of non-communicable diseases like diabetes. So I think for us, the health risk and the health narrative comes first for us at Gatefield. That is the number one rationale for, going on this, embarking on this advocacy journey. And secondly, the revenue generation potential of a fiscal policy like a sugary drinks tax can also do a lot for Nigeria's, health systems. When it comes to other examples and case studies, I always like referencing South Africa. So South Africa introduced the sugary drinks tax through a policy called the Health Promotion Levy, and essentially revenue from this tax is being used for health promotion.
The future of Nigeria's fight against diabetes depends on action today. Without significant improvements in healthcare access and affordability, the number of those affected will continue to rise, with devastating consequences for families and communities.
It starts from childhood. You can't bring your child up on cornflakes, what are those sweet cereals and things, and then expect them to be able to stop when they become adults. It's very difficult. Donuts, all those nice things that we give our kids should, from an early age, start to make them eat healthy.
Despite the challenges, there is hope. Community-based initiatives, local NGOs, and government programs are striving to make a difference. These efforts emphasize prevention, education, and early detection, crucial components in the fight against diabetes. A notable organization working towards this goal is the Olusegun Obasanjo Foundation, established by former Nigerian President Olusegun Obasanjo. Having managed diabetes himself for over 3 decades, Obasanjo is deeply committed to raising awareness and improving care for others facing the same struggle.
As I said initially, I didn't pay attention to it. And then my frequent urination started getting worse and worse. And that was when I realized that I had a problem. I remember I had to give a lecture somewhere, and then while giving the lecture, I was so pressed that I have to go leave the lecture and go and urinate. And then I knew that I had a problem. So from then on, of course, I took it seriously. And I believe that if you are diabetic, you have to watch your weight. You have to watch what you eat and how you eat. Not only what you eat and how you eat. You have to exercise. And that is very, very important.
Do you still
I had a few friends, about 5 or 6 of them, who are diabetic. They never did any exercise. They ate. How do I put it? Recklessly. And when you see yourself bloating out, then you know that you are not doing what you should do. Now, I still play squash, and squash is a vigorous game. You have a game of squash for 1 hour. You have enough exercise. I play 3 times a week: Monday, Wednesdays, and Fridays. When I'm around and when there's a squash court and a partner to play with, I take strictly to my medication. I brought for medical checkup. I was told that something chemistry that I have, and my doctor said, "You've been a bit naughty." Looked at the thing. I said, "Well, look, I've been using honey to drink my akamu, ugi." And he said, "You have to stop." Because honey, although you don't think it's sugar, it converts ultimately. Yeah. But what I say to people um, is what I coined as dreams. I'd say call it dreams with plus C. And D is diet. We've talked about that. Not even if you don't have diabetes, um, as you grow old, you must watch what you consume in terms of food, in terms of drink, even in terms of what you listen to, because it's part of consumption. All the drugs that are imported have gone up as a result of inflation. And I don't know when you say, well, nothing to worry about. Those who die because they cannot afford the cost of medication because the price has gone up.
Yeah.
Well, you don't have to worry about them. If you don't worry about them, those who lose loved ones through death because they could not afford medication because of high cost, well, they know that they know what it means that they have lost loved ones.
I'm scared that I will not be able to afford medication in the nearest future because the rate at which things are going, I'll have to make a choice between having to take my drugs or having to just do the things I need to do for myself. It's getting to a point where it's a trade-off because the moment it crosses 200, if I'm using 200K to buy drugs, what else am I going to use to live? So it's getting to that point where I have to make that decision. Do I really want to even stay alive? Is life that worth living that I want to take? I want to do that.